What self-care strategies can help with menopause-related mental health issues? If you've been wondering that, then you're in the right place. Because the truth is that most of the advice out there barely scratches the surface. So let's fix that. So what are you going to get from this video? First, we'll look at why your usual self-care tools might not be working right now and why it's not your fault. Then I'll walk you through the kind of self-care that actually supports your mental health during menopause. Things that soothe your brain, not just your body. And finally, I'll show you simple, gentle ways to start today, even if you're feeling exhausted, flat, or completely overwhelmed. If you've been trying to look after yourself, but you still don't feel any better emotionally, this could be the missing piece. You've probably heard it all by now. Journal more, take deep breaths, practice gratitude. Maybe you've tried all of those things. But when you're going through menopause, something changes. What used to help doesn't always go deep enough. And when that happens, it's easy to turn the blame inwards, thinking that you're not doing self-care properly, that you should be coping better, that you must be doing it wrong. But maybe the problem isn't effort, maybe it's approach. Most advice is like splashing cool water on your face during a heat wave. It feels nice for a moment, but what you really need is shade, rest, and something to drink. Without calming what's happening inside your system, no amount of trying harder is going to reach that part of you that's been struggling. Because the truth is, most self-care skips over that one layer that matters most during menopause, and that's your nervous system. And once you understand that, everything begins to shift. So let's start with why your old self-care might not be working anymore. Maybe, as I say, you've been journaling. Maybe you've been exercising. Maybe you've been doing all of the so-called right things. And yet you're still waking up feeling flat, anxious, or numb. That's not because you're doing it wrong. It's because menopause changes your brain chemistry, your stress response, and your emotional resilience. And when estrogen drops, your nervous system becomes more sensitive. So what used to feel soothing might now feel pointless or overwhelming. And surface level advice can feel like one more thing you're failing at. And it's not that self-care doesn't work, it just needs to change to meet you where you are now. So let's talk about what actually helps. The kind of self-care that goes deep enough to support your nervous system. So things such as breath-led techniques, such as hand-on-heart breathing, that actually anchors you in safety. Then there's clinical hypnotherapy or guided relaxation. These can gently shift your brain out of fight or flight. How about letting yourself rest without guilt? Even 5 minutes with your eyes closed can really help. How about trying some simple grounding? And you can do that by noticing 3 things around you that you can see, 3 things you can hear, and 3 things you can feel. Then there's soothing sensory input, such as wearing soft fabrics, having warm drinks, smelling calming scents, whatever feels gentle to you. And you can name exactly what it is that you feel without trying to change it. I feel flat today. That's enough. Then there's quiet connection, sitting with a pet, texting a trusted friend, or being outside near nature. And if you're not sure where to begin, then ask yourself, what would soothe my nervous system today? Just to be clear, it's not food or alcohol. Menopause self-care isn't about fixing yourself. It's about softening what's been hurting for too long. This doesn't have to be a full routine. In fact, please don't turn it into a checklist. Think of it more like a menu. Choose one thing. Let that be enough. Even 30 seconds of the right kind of care can shift how your body feels. You don't have to do everything. You just need something that reaches that part of you that's been struggling to stay afloat. And now that you've seen what kind of self-care actually supports your mental health during menopause, you might be wondering what self-care strategies can help with menopause-related mental health issues in a more lasting way. That's exactly what I'll walk you through in the next video. I'll show you a gentle, deeply calming way to support your nervous system that takes no effort at all. Just a few minutes and a quiet place to sit and relax. It's called clinical hypnotherapy. It's not a stage show kind of hypnosis. This is safe, relaxing, and it's created specifically for women like you going through menopause. And it works by supporting your mind and your hormones, so you can finally feel a little bit more like yourself again, without trying harder or pushing through. If you've been looking for a self-care strategy that actually reaches that deeper part of you, the part that's tired, stressed, or emotionally flat, this might be exactly what you've been needing. So go ahead and watch that video next. It's right here.